Today I will be demonstrating how to perform dorsal and palmar glides for the radiocarpal joint. In order to assess the movement of the radiocarpal joint, glides are often utilized. Dorsal and palmar glides of the radiocarpal joint can be used as both an assessment or treatment tool. In order to assess extension, one should perform distraction followed by a palmar force. In order to assess a patient's available flexion, one would then provide slight distraction and glide dorsally. Important landmarks to note as we are performing the dorsal and palmar glides include the styloids of the radius and ulna, here, and the carpal bones. We are looking for the pisiform and the scaphoid tubercle. Here and here. All right, and once these landmarks are identified, the assessment of the radiocarpal joint can be performed. So in order to assess the radiocarpal joint, the patient's hand should rest over a table, in this case we're using a foam roll in order to allow for a force to be given. The therapist should stand by the side of the patient, and then the therapist will grasp the scaphoid tubercle and the pisiform with their index finger and their thumb. So I place my fingers here and palpate, and I'm stabilizing at the radius and the ulna. With my distal hand, first I will be applying some gentle distraction, and then I will pull the carpus perpendicular to the table and appreciate this motion. Test the patient's other side for comparison as well. Assess for infeel to determine if the joint is either hypo or hypermobile. So Blair, what I'm going to do is I want to stabilize here at your wrist, and I'm just going to pull away and then push down and up just to assess this joint motion. Okay? And that's how you perform a dorsal and palmar glide of the radiocarpal joint.